Canada's Auditor General issued a series of reports on the pandemic to Parliament today. Among her findings, the Public Health Agency of Canada could have been better prepared for the pandemic, and the federal government ignored 2 decades worth of warnings to improve its systems. The auditor also found that the agency failed to properly follow up with incoming travelers facing quarantine. She also found good and bad with the rollout of those emergency financial supports during the pandemic, and she's also got some serious concerns with the federal government's massive infrastructure program. Auditor General Karen Hogan joins me now. Karen Hogan, thanks for taking the time.
Hi, thank you for having me.
There's so much in this report, but let's walk through it. Can we start with the pandemic response from the Federal Public Health Agency? You say that the agency could have and should have been better prepared for the pandemic. What were the key findings, the key failings of the agency?
Well, what we found in our audit was that, as you mentioned, the Public Health Agency wasn't as well prepared as it could have been. And I would highlight that or categorize it in four big areas. First, it was the emergency health plans had not been updated. More importantly, the federal, provincial, and territorial response plan had not yet been tested. The second thing was that there were many longstanding issues about sharing of surveillance information with the provinces, territories, and the federal government hadn't been addressed, including, increasing the capacity of the IT infrastructure in order to handle the sharing of that data.
Okay.
We saw a risk assessment tool that was outdated, and then finally, they just weren't prepared or hadn't planned for a nationwide quarantine.
Okay, what do you mean by that risk assessment tool that wasn't the right kind of tool? Can you explain that?
Well, they have a risk assessment tool that it predicts the risk that a virus will spread. And the tool was a pilot tool, so it hadn't yet been tested.
Okay.
But the tool was not designed to consider a pandemic. And so it didn't consider that the spread from another country to Canada, only once what would happen once it was in Canada.
Okay.
And hence it underestimated the risk of the virus. And it remained at low until the Chief Public Health Officer intervened and requested that it be raised based on her knowledge of what was going on across the country and across the world.
Okay. You expressed discouragement, and you alluded to it, that the agency dragged its feet, that it had warnings, and that for as much as 2 decades, things could have been done, issues could have been addressed. Can you give an example?
Oh, absolutely. We've had findings dating back to 1999 in some of our audits, again in 2002 and in 2008, and most of them centered around the sharing of health information with the provinces and territories. Being able to have our information about symptoms, for example, in a timely way really doesn't help inform the response and change the response as it needs to change in reaction to an emerging virus. And so those were the kinds of things that we had identified that even the department had identified in its own lessons learned following H1N1 and SARS.
Okay.
And so it was discouraging that they hadn't addressed those in all this time.
Okay, another thing you touched on was the adequate, you said that there was not adequate follow-up, and this made it to the news, of travelers to Canada during the pandemic who were supposed to be self-isolating or quarantining. What kind of concerns did you have?
So we saw that the Public Health Agency really hadn't planned or anticipated a nationwide quarantine of this scale. They recognized that they needed some additional help and capacity and got some support from other departments, but they set a target to follow up with every traveler that needed to quarantine. And in 2/3 of the cases, they did not follow up and were unable to let us know whether or not the quarantine measures were actually effective.
Okay, let's look at something on which you were more even-handed in the sense that you saw some positive and some negative, and that is the multi-billion-dollar support programs, the CERB, which is the emergency benefit, as well as the wage benefit. How did the federal government do?
So in both of those cases, in the emergency subsidy for individuals and in the wage subsidy for employers, we saw the Department of Finance, the Canada Revenue Agency, and Employment and Social Development Canada collaborating well together. They designed a program in record time and rolled it out. They implemented some prepayment controls, but they really, in some cases, missed an opportunity to implement some controls that they should have been.
Mm-hmm.
They prioritized the speed of getting a benefit to Canadians and put emphasis on post-payment controls, which is going to be the subject of another audit from our office because it's a really important matter to follow up on.
So in other words, following up on how they follow up on people who have defrauded or gotten payments wrongly.
Absolutely. We're going to be looking at how they finalize that plan. So they still haven't finalized that post-audit payment plan, but we want to see how they're going to design identifying whether payments were made in error and then recovering those payments if need be.
You called for something which is essential and very important, and that is a post-pandemic independent review of how this country responded to the pandemic. Why and what kind of review?
I absolutely think that we need to sit back as a country and look at our response and figure out how to be better prepared for the next crisis or health emergency that might come our way. As the federal auditor general, I can only look at federal programs and federal spending, and I can't look at provinces and municipalities. And what we've seen through the pandemic is that so much of the response, because it's health related, is governed by the provincial and municipal governments. And hence, we really do need an independent review across the whole nation to make us better prepared, to put some value on preparedness.
Okay, we're racing through a lot of things, but you also reviewed this huge multi-billion dollar, $188 billion infrastructure program called the Invest in Canada program. This has been criticized on different accounts by the parliamentary budget officer. What did you find when you looked at this massive keynote program of the Trudeau government?
The Investing in Canada plan is really a horizontal initiative. And so what does that mean? It means that there are so many departments across the federal government that are involved in it that receive common funding and should have a common goal. What we found is the lead department, which is Infrastructure Canada, was unable to report on the progress that all of these initiatives were making and whether or not it would be on target to meet the objectives of the plan. This is not a new issue. It's one we've seen often on horizontal initiatives that really does need to be addressed.
And is the money getting out there on time, or do they not even know if the money is getting out there on time? Because I know the parliamentary budget officer has referred to delays and money not getting out the door.
I think we had the same finding as the parliamentary budget officer. We saw that in the first 3 years of the program, about $9 billion had not been spent as planned and pushed off into future years. And no one was really tracking the effect that might have on all these, on the meeting the objectives of the actual plan. And so the spending is just pushed to later, might risk the delay of the projects being completed on time and the plan meeting its objectives.
Okay, Karen Hogan, I want to thank you very much. I know a lot of people in Ottawa and across the country watch your observations, pay attention to your observations, and will respond to them. Thanks for speaking with us.
Thank you for having me.